grew up in the United States. I lived most of my life there, and having a lot of different mysterious chronic health issues. I've seen lots of doctors and specialists, been to the Mayo Clinic. I've had a lot of medical care in the U.S. throughout the course of my lifetime. So I would say I have a good experience in medical, the way the system works in the U.S. But I can't speak for every state. I can't speak for every county. I can't speak for every situation. I can only give my personal experience. And the same goes for living here in the UK. I've been here for 4 years. And again, I've seen my general practitioner and experienced their practice, as well as being seen at a few NHS hospitals and in 2 different trusts. Now, I would say there was a lot of differences between American healthcare and UK socialized healthcare, or the National Health Service. A lot of times my family will ask me questions about it, saying, is the care better? When I first lived here after my son was born, I was almost inclined to say yes, but to be honest, both systems have their pluses and their minuses. So I hear a lot of people making some really wide generalizations about how U.S. healthcare works versus how it works here. The GP system, or the primary care provider system, is pretty much similar. Your GP or your PCP is your main point of contact, and from there you will see specialists, or as they call them in the UK, consultants. And that system is pretty much the same. It's the same sort of setup. Now, is it going to work differently from GP practice to GP practice, or primary care practice to primary care practice, and from different private insurance in the US to the NHS? Yes. More than likely, it's not identical. If you're an American and you come here and you receive healthcare, you will be in shock. Not because the quality of care is not good, it is just different. One thing I can say is I have the experience from having a lot of experience with healthcare in the United States. Oh, and there's a random cat that has just started rubbing on me. I have a lot of experience as a patient in the U.S., but as I say, I have not been to every hospital. I have not lived in every state. I cannot speak to every form of private insurance. I just know that when I would call my primary care physician, I would ring up, the receptionist would say, what do you need to be seen for? And they would let me know when I could get in. And a lot of times I could get in the same day. It is not unlike that here with my GP practice. I ring up, they say, what do you need to be seen for? I tell them, they say, is it urgent? Do you need an appointment the same day? If it's urgent, I will say yes, and I will explain my situation. If it's not urgent, it's usually about 2 weeks before I see my GP, and that's fine. I understand for efficiency's sake, you can't always get in the same day. I'm fine with 2 weeks if it's a non-emergency. If it's something that I'm very concerned about, then I can get in the same day in the evening, and it's not a problem. One thing that I like about care here is I do get offered a phone call. So if it's something that's not urgent, like I need to review test results, or it's something I don't need to be seen in person I don't need to be seen in the practice for, then I like the option of being told, right, we'll have a GP call you, what's the best number for you? They'll call you between this time and this time, and you can discuss that issue. If you need to be seen, they'll arrange that for you. Great. That's not an option I had with my primary care provider in the United States. Very infrequently did she ever call me. Here, things that are not emergencies, I do get a chance to speak to my GP. So that's a great thing. Now, I can't speak to every NHS trust. I have noticed varying levels of the good and the bad. I can say that my experience with pregnancy and with frequent appointments was great in this country. I have no complaints about my pregnancy experience, other than I had 2 really annoying and distasteful midwives who refused to believe that there was anything wrong with my uterus and that I needed to have a natural birth. Unfortunately, I had a very large fibroid in 2006 to 2009 that nearly ripped my uterus in half, and I did have to have an embolization and a myomectomy, and the integrity of my uterus was not great. So yes, I did need to have a C-section, but they could not accept that. And I saw probably 7 consultants between the US and the UK, and every single one agreed that a C-section was the best route to go. So, but you're always going to encounter people that think you should do what they think you should do. I think a lot of people don't have the experience of living in the US and being intimately aware of how things work. And I've heard comments, well, you can't get medical care. You can get medical care if you're not a citizen. An ER is not going to turn you away. However, other types of care, it's going to be a bit different. Just like here, no one's going to turn you away, but you may have to deal with a payment option or pay a surcharge. When I first moved here, I did not have to pay the surcharge, the NHS surcharge. That was put into place after my visa came through when I moved here. But when I renewed my visa, I had to pay an almost £700 NHS surcharge for a 2.5-year visa. In any case, I could go into the nuances later, but right now that's just kind of what's on my mind. I'll talk about some specifics at another point in time, but really I think the takeaway message here is it's very easy for us when we're tourists to go to one country and to think we understand the system from a very limited experience of one appointment, one hospital trip, one experience that is a first-hand experience or by other people's second-hand experience or a third-hand story. And it's the same when you come to the UK, you don't live here, you've seen one GP or you've had one experience. You may feel really tempted to say, well, this is how it works, without actually living here and actually experiencing it every day as a patient. Are both systems flawed? They absolutely are. Is healthcare probably flawed around the world? I would suspect so, even though I've never lived in, say, Japan or China or Canada. I have lots of friends in Canada, and I hear that things are quite similar and work really well. But is it perfect? By no means is it perfect. But the longer that you live somewhere, the more you learn to accept the nuances and the differences and sort of learn that, in general, the way we take care of people is not perfect. And that could go on and on. But that's just my thoughts for today. So in any case, have a great day, and I'm going to go and start getting dinner ready. Take care. Bye-bye.